Hey, this is Nick and Ron and Nick.
Good morning.
We are happy to be together doing this video pod together instead of separate. Kind of a new experience for us.
It is. I've never been this close to you before.
I'm touched. I'm touched. And yes, it's actual coffee, not prop coffee. So we are talking about the world of healthcare architecture, and it's a pretty exciting topic to us. Obviously, it's one of our passions.
Absolutely.
Today's topic is going to be talking about the multiple clients that we have to deal with. You know, when you do architecture, you think about the client and then the users, in our case, patients. But the third group?
Staff.
Yeah.
Of course.
Staff is really, really, really important. They are the lifeblood of any hospital and can get the best care for their patients with the best spaces.
Right. So when we're designing those spaces, we really have to think about, all of the different people that are using them. It's not always just the patients, like we talked about, but it's also the staff. And we have to kind of anticipate their needs so that they don't have to constantly be thinking about that stuff where they're trying to serve those who need them.
Exactly. And, 15, 20 years ago when I was in the hospital as the owner, I can remember we had apartments set aside and we'd actually have to go outside of the country to find nursing, just the sheer numbers that were required. And it continues to be a problem today. And so it's so important for us to be able to develop those spaces that make it easier for the staff to do their job.
Right, because you want to not just attract your staff, but you also want to keep them, and you want to let them work in spaces that they enjoy being in, that they feel like they're, have some cross collaboration so that they can work on their personal growth.
It's like the staff when you're in your office, right? So Nick and I work together all the time, and we haven't driven each other crazy yet, but it's collaborative, and we're always talking and we're always working. But if you think of the situation in a hospital, it's life or death. Those folks have to perform at a high level all the time, and to do that they need spaces to get away from that too. It's not the daily grind of being with those patients all the time. So we think about materials, we think about getaway spaces like lounges and just a place to go get some fresh air.
We're not just thinking about what the owner needs for building maintenance and building support, but we're also thinking about the staff. Cross collaboration, those camaraderie spaces, spaces to serve them just as much as serving the patients, because in the end it's the user groups that's serving the patients.
Absolutely, and I got to say, not that it's ever occurred, but we don't want to get to the end of the project and have a staff member say, "Oh, I didn't think it was going to look like that," right? Because then you go, "Oh, geez, we did something wrong."
Absolutely.
So having all those user group folks actually in our job meetings is fantastic. We love that feedback, and they say when they get to the space, "Wow, that's kind of what I thought it was going to look like, and this is great." That's the win-win. So reach out to us. You can get us through our website. All of our LinkedIn accounts, I'm sure, will get shared. And reach out to us and we can have a conversation. It'd be a lot of fun.